Hi, Mr. Perez. My name's Kyle Matthews. I'm going to be your nurse today, okay?
Okay.
First, I'm going to start by confirming your date of birth.
September 4th, 1994.
All right, and what are you in here for today?
I have, my stomach's really been hurting the last couple of 3 hours.
Okay. Could you tell me if that came on fast or slow?
Progressively slow.
Okay.
And now it's painful.
All right, and you said it's been going on for a couple hours now?
Yeah.
Could you describe that pain for me?
So it feels like my stomach is contracting
Okay.
at points and then just releasing and then contracting again.
Okay. Would you say it's cramping, sharp, dull?
Kind of sharp pains.
Okay.
It's not really cramping.
Does anything make it feel worse?
Well, I took some Pepto-Bismol and that was, no.
No, it didn't help?
No.
Okay. Does movement make it feel worse? Would you say?
If I sit still for a couple minutes, it goes away, but if I need to do anything, it comes right back.
Okay. All right, sounds good. So I'm going to go ahead and I'm going to kind of assess you from head to toe from here, okay?
Okay.
So first I'm going to start looking at your skin. I noticed that you're free of any lesions. You have a few freckles here and there. No discoloration. I'm going to look at your hair to make sure you're free of any infestations. You don't have any dandruff or anything like that. I'm going to look at your fingernails real quick. Fingernails looking. I am going to look, I'm looking at your fingernails for any color, any clubbing, and checking your nail beds. Nails look good. I'm looking at your head to make sure that it's normal, cephalic, atraumatic. Face, I'm going to check for symmetry. Go ahead and smile for me. Go ahead and raise your eyebrows. Puff out your cheeks. All right, cranial nerve 5, cranial nerve 7 is intact. Go ahead and palpate. Any pain there where I touch? Tenderness?
No.
Okay. Go ahead and check the temporal arteries, check for the TMJ. Go ahead and move your jaw side to side. Any pain?
No, not really.
Nope. All right, good. I'm going to go ahead and check your lymph nodes, preauricular, postauricular, occipital, jugular, digastric, submental or submandibular, submental, deep cervical, superficial chain, and supraclavicular. From there, I'm going to go ahead and go on to your ears. I'm going to run a couple tests, okay? Let me know what I'm saying. I'm going to whisper.
99. 99.
Okay. I'm going to do a Renee's test and a Weber's test with a tuning fork if I had one. And I'll go ahead and use an otoscope. I'm going to check the inside of his ear, pull up into the back. I'm going to inspect the tympanic membrane, make sure it's gray, cloudy. I'm looking at the tragus, the pinna, make sure that everything is symmetrical, make sure there's no discharge. I'll go on to the nose. I'm going to look inside the nose for any polyps. Do you have any trouble breathing through your nose?
Sometimes.
Okay. I'm going to look at the turbinates, make sure that it is not gray. From there, I'm going to go on to the eyes. First thing, make sure that, can you go ahead and take off your glasses for me for a second? Note that the patient is wearing glasses. Do you wear contacts at all?
Sometimes.
Okay. All right, go ahead and look at my nose. I want to make sure that they are perla. Pupils are equal, round, reactive to light at approximately 2 millimeters. Go ahead and look at my light. Okay, he has good accommodation. I'm going to do a handheld Snellen chart evaluation. Accommodation was good. I want you to go ahead and follow the light. Diagnostic test. Good. And I'll go ahead and do a confrontation test to check for his peripheral vision. Let me know when my fingers come into your eyesight, okay?
There. 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 There.
All right, so far I have checked cranial nerves 2, 3, 4, and 6. Check cranial nerve 1. Go ahead and smell this for me. Can you smell that?
Yeah.
Cranial nerve 1 is intact. I'll go ahead and check the mouth and pharynx. Go ahead and open your mouth real quick. I'm gonna assess tonsils, tongue. Tonsils are about a +4. Check the buccal membrane. Go ahead and say ah. All right, stick your tongue side to side and up and down. Okay, palate retract, say ah again. All right, good. Go ahead and tilt your chin back. I'm gonna assess the trachea, make sure trachea is midline. And go ahead and shrug your shoulders. Cranial nerve 11 is intact. All right, from here, I'm going to check your chest. I'm gonna inspect, make sure that when he breathes, I see equal expansion on each side. I don't notice a barrel chest, which means that he is not indicative for COPD. I'm gonna assess skin. I'm looking for any heaves. I'm gonna go ahead and palpate. I'm gonna palpate on expansion. Go ahead and breathe in and out. Okay, on the back, I'm gonna do tactile firmness. Every time you feel me press down, go ahead and say 99. Or, yep, say 99.
99. 99. 99.
I'm gonna check each position
99.
bilateral.
99.
All 9 positions
99.
on each side.
99. 99. 99. 99. 99. 99.
Okay, tactile firmness is intact. I'll go ahead and percuss for resonance in the same spots. Okay, percuss for resonance. Now I'll go ahead and auscultate anterior and posterior. It's kind of hard to do this with headphones on. Go ahead and breathe in each time. Do it midline to avoid auscultating over the scapula. All 9 places. All right, next I'm gonna go ahead and listen to your chest. I'm gonna listen for heart tones over the aortic, pulmonary, Erb's point, mitral, tricuspid, and I'm gonna palpate the PMI. Good. Good S2 over the AV sounds and S1 over the semilunar valves. I'm going to go ahead and go onto your abdomen. I'm going to start by, inspecting, make sure that the curvature of your abdomen is in order. Then I will go on to listening to your abdominal sounds real quick. Okay. Normal bowel sounds over each quadrant. All right, after I've auscultated abdominal sounds over the quadrants, your aortic, renal, and iliac arteries, I'll go ahead on to percussing. I'm going to listen for tympany. Okay, tympany, and then I noted dull tones over the liver and spleen as normal. And then I will go ahead and palpate. So go ahead and sit up a little straight for me. I'm going to kind of do superficial while Z tracking. Any pain while I palpate?
A little bit.
Okay. All right, I'm going to go a little deeper. Okay. All right, and then I'm gonna have you go ahead and take a deep breath, inhale. I'll feel under the 11th rib for the liver. Feel for the spleen. The spleen should not be palpable. Next, I will go ahead and I'll palpate the inguinal and femoral lymph nodes. Last thing will be to check the costal-vertebral angle tenderness. Go ahead and lean forward for me just a bit. Any pain?
No.
All right. Good kidneys. Now go ahead and check your extremities, all right, sir? So go ahead and stick your hands out straight in front of you. Both of them, go ahead, Frankenstein. There we go. I'm looking for skin color. I'll go ahead and palpate down the joints. Any pain in your joints? All the way down to all the fingers. Good. Any pain? Noting any redness, swelling in the joints or edema? All right. So I want you to go ahead and stick them back out for me again. Go ahead and flex. Move your wrists. Go back. All right. Push against my hands. Good. Push, push, push. Go ahead. All right, now go ahead and put them straight. Pull against my hands. Bicep curl. There you go. Pull me towards you. Good. All right, now same thing. Up. Push against my hands. Push. Good. All right, same thing with the legs. Go ahead and pull up on your legs. All right, good. Pull up on your toes. Push against my hands. Good. Any numbness or tingling down here in your feet? I'll go ahead and check the far extremity pulses at the tibial, dorsalis, pedal, and popliteal pulses. Check femoral pulses. And I will check for sensation. Do sensation tests down the extremities. And I've checked for motor and strength. Good.